Thank you, Joe Steer, for coming on to ADHD Girls. And really interesting for me to connect with you and have a chat with you about the work that you do. My name is Samantha Hugh. I'm a communications consultant and coach, founder of ADHD Girls, who created the Conversation with Women with ADHD campaign to improve the awareness of ADHD in women around the world and to destigmatize ADHD. So I was so grateful when Joe agreed to come onto my channel, to talk a bit about this subject, because Joe has recently written a book, Understanding ADHD in Girls and Women, written with a combination of experts and girls and women who have lived with ADHD. So let me introduce Joe a little bit. So Joe Steer is a consultant clinical psychologist who specializes in working with children, adolescents, and their families. She's the Associate Director of the Emotional Health Service at Achieving for Children, a community interest company working on behalf of the boroughs of Richmond and Kingston. So she provides camps in the area of Tier 2 alongside the mental health support teams in schools. So thank you so much again, Joe. Can you maybe start by telling me a bit about the new book that you've edited? What take-home messages do the book offer to girls and women navigating life with ADHD?
Okay, so yeah, I'll tell you a little bit about the book. So it's really a book aimed at professionals, but also aimed at parents of girls with ADHD, women themselves who may have ADHD, and perhaps an older age group of girls. And what we've done is, as you said, really a collaboration of lots of experts in the field coming together to write and share some advice and reflections, and really, I suppose, energize the conversation around ADHD in girls and women in the UK specifically. But also we hope that it will be really useful internationally as well as a text. And what we've done is we've explored lots of different areas within ADHD in girls and women. So we've got a couple of experts in women specifically. And so Sally Cubbin and Alison Parry have talked specifically about assessing women for ADHD and some of the complexities around that and some of the difficulties that can emerge, and then also the treatment of ADHD in women, and what needs to be thought about and taken into account. And that's really useful for, I think, women themselves to look at, but also for the actual professionals that work in that field. So lots of really good tips. And then the remainder of the book is mainly focused on girls, and there is some chapters around assessment and the screening process. So some really good tips in there for parents about if your child is being assessed for ADHD, what you might want to think about, what's really important to mention in your assessment. Some important information for schools, particularly about if they're concerned that a girl might have ADHD in their class, what they need to be thinking about in terms of for assessment. And then we've also got much more on treatment and I suppose support for girls. So not only medication, but also alongside medication, we'd be thinking about maybe psychological therapy or coaching as well for ADHD. And finally, and probably one of the most important chapters of the whole book is, and we were super lucky that Eva Akins, who is a lawyer for special educational needs, has contributed a chapter where she really sets out extremely clearly all the legal aspects of SEN in the education system, and kind of takes parents through their rights and what support they can expect and be talking to schools about. And that's, I suppose, written around her own personal story of ADHD with her own children, but also herself personally. So I absolutely love that chapter. I think it's super helpful, but also very powerful in the message that it gives to the readers around what you can also achieve with ADHD. which is super important. So I think the book, in terms of a take-home message, I think really what we're trying to do is to show girls and women that there is some understanding out there now. It's improving all the time, but also to improve connection between girls and women around ADHD. So throughout the book, there is loads of quotes directly from girls and women themselves. And the final chapter is a collection of stories from girls and women about their experiences with ADHD. And I think that for me is extremely powerful. I think for any woman or girl reading that, there will be many experiences there that they will have had themselves, and hopefully that will help them feel connected to a bigger group and a bigger mechanism of support, really.
Well, it sounds really impactful, Jo. You know, I actually want to read it. I mean, I keep meaning to buy the book. So it's available on Amazon and Waterstones and
Yes, all the usual places you can buy books. So, but absolutely Amazon, and the publisher is Jessica Kingsley, so you can buy directly from them. But also, it's available as an audiobook, which is really helpful because we know some people actually really just don't like reading, and that's okay. You can listen to it, and you know that's a different way of approaching it.
Yeah, I think personally for me, I love audiobooks, you know, because like you say, it's hard to really sit down for a long time to read a chapter or a paragraph. But then when you mentioned that there is this chapter by Eva, you know, who writes about the legal side, or, you know, how parents can approach schools, I think it'd be really helpful for people to get it in, you know, book format as well. You know, then they can refer back like step by step, you know,
Yes.
because I know a lot of parents are navigating difficulties in getting their children the right accommodations in school. And I know in the last year, the demands have increased overwhelmingly because of lockdown. And even as for myself, you know, trying to get my daughter an ADHD diagnosis, like even in the private side, as I've actually asked your advice as well, the waiting list is all the way until December in most of them, you know, and the alternative is that you might have to pay a lot more money, you know, to get seen quicker. So I gather that you have so much experience working with children and adolescents with ADHD, and you've written a book specifically targeting girls and women with ADHD. Why is this your area of interest and specialty? Like, is there a reason why you think maybe ADHD symptoms in females can be more misunderstood and missed? So it would really be interesting to see what your opinion on this.
Yeah, so I think there is definitely some significant evidence that girls actually often are missed in terms of those diagnoses, and particularly early identification. And I think over the years, I guess in my practice, I've noticed that more and more that girls tend to present to services for an assessment in their teenage years, or actually even in their adult life. So sometimes there's the experience where we're working with a family and we may be assessing the boy, and actually then mum might reflect on her own experiences throughout life, and then also begin to wonder whether she too might have ADHD. And I think through, you know, having that repeated experience with many mums, and then also the girls that come who are teenagers, and we see lots of boys who are typically, you know, 6 to 10 in their age group, there's definitely a difference. And I think I'm really interested in that difference and what that's about, as you say, what's going on there. And I think we know that there's no one straightforward answer. There's lots of factors at play. So one thing we know is that girls often present with ADHD slightly differently to boys. So they may be much more likely to present as inattentive, in ADHD inattentive type, rather than a combined type diagnosis. So those symptoms of maybe daydreaming and losing concentration and attention, and struggling with organization, they are are the particular focus of the difficulties for girls, and they often are difficulties for boys too, but boys also in combination usually have the hyperactivity and restlessness, and also so that kind of bouncing off the walls that we talk about when we talk about ADHD, and impulsivity, so perhaps getting into trouble, doing things without thinking, maybe getting involved in some kind of fights and arguments and things like that for boys. And so what tends to happen is that those boys come to the attention of their parents, but also their school staff much more easily than the girls who may be similarly struggling with inattention, but they're quietly struggling, and so they're actually not coming to the attention of parents or school staff as much, and therefore not being referred as much into assessment services. But what we see happening is that often key transition points in a girl's life can then actually bring those difficulties into focus. So transfer to secondary school or high school is a really big one. So we definitely see a spike in referrals that come in that year 7, year 8 group in the UK, and the girls are moving to secondary school and those difficulties become a lot more obvious. And you know, that's for a number of reasons. Obviously there's lots more social expectation at secondary school. There's a big expectation around being able to organize yourself properly, what you need for the day, getting yourself around a building in one piece, traveling independently sometimes as well, and also hormones kick in. And we know that actually the hormones also do have an impact on the symptoms of ADHD, and they can make them worse. And so I think perhaps some of what happens is that those difficulties become much more apparent at that secondary age transfer, and similarly on transfer to college or university, sometimes into the workplace, or those. So when life just changes and gets a bit more challenging, similarly we might see difficulties on transition to college, to university, or into the workplace. And the authors of the chapters on adulthood and ADHD also talked about how perhaps when women have children or change jobs, that those changes in life can sometimes then magnify the difficulties, because what we also know is, and particularly for girls, younger girls at primary school, sometimes the primary schools are very nurturing, very supportive, and they put lots of strategies in place that are really helpful for these girls. And so actually the difficulties are managed in primary, and then when they go to secondary school, it's, you know, lots of that scaffolding is removed, and they're really out on their own, and that's when it becomes really obvious that there's something significantly an issue really for those girls. So I mean, that's one aspect of it.
Yeah, I think what you speak, you know, it's like a bird's eye view point, you know, on how a girl, you know, as they navigate, like you say, childhood, you know, primary school to secondary school, puberty, adolescence, you know, college, university, work, motherhood, you know, and the list goes on up to menopause. You know, each and every point and in this transition, you know, will contribute to the manifestation and the worsening of ADHD symptoms. But for so many of us, you know, me, for example, who were diagnosed at the age of 40, you know, we sort of go through life thinking sometimes it is just hard because, you know, everyone experiences it, right? But you don't know that the degree to how you experience it. The sense of overwhelm is so much stronger than neurotypicals, that you don't question it, but then actually just suffer in silence.
Yeah.
And you know, like you said, there are girls who can present as inattentive, but then for the combined girls, I've heard that because the awareness was so low, that even if they present in impulsive and hyperactivity, it is still missed. And my daughter, for example, has got combined ADHD, I think, and she is extremely impulsive and hyper, but she has managed to tone down the hyper side, but she is still impulsive, and that leads her to getting told off. And we actually submitted a referral to camps, but the school almost insisted that because she was meeting her learning goals, that she was fine. But she's in year one, the learning isn't exactly that challenging, is it? And
Mm.
I've got interventions, and even if they are giving her interventions, she insisted, because of the observation, the one-on-one observation they've given her, they said she's fine, but I think anyone could be okay with a one-on-one, it's in the
Yeah.
classroom of 30. And when you have sensory overload, stimulation from everywhere, and also inability to receive the instructions and perform the task to instructions, can lead to them getting told off, for not doing things right, and then they get confused about why they couldn't do it despite trying so hard. That can really cause a lot of anxiety going to school. And
Yeah.
while she is fine in school, she's presenting as quiet, withdrawn, and shy, which she
Mm.
isn't. She is never like that at home or with her best friends from childhood. She is gregarious, and at home she melts down. She has various different like mood levels when she comes home, and it's so obvious to us. And I recently read a book. It's an audiobook actually with a similar title to yours, written by Kathleen Nadeau and Alan Littman's Understanding
Yeah.
Girls with ADHD. And they mentioned within the elementary, which is a primary school
Yeah.
level, what sort of characteristics to look for. And each and everything they mentioned was a tick for us.
Mm.
It's like a check, 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 check. I was like, and I told my husband, and he's like, how do they know her? So they're so eerie. Like, but then yet the school has said to us, she doesn't have ADHD. And they said, if you insist she has ADHD, then, they almost kind of say, just wait a bit, observe. And then in the meantime, whilst we wait, she has developed more and more anxiety.
Mm.
How do we circumnavigate that? How do we improve the school's awareness of ADHD as a parent of your
Yeah.
currently undiagnosed child?
It's so important, isn't it? And I think absolutely more training and support for schools and school staff is absolutely central to this, and specifically on ADHD in girls, not just ADHD generally. So when we do deliver training to schools on ADHD, we would also include some additional information about how things might look a bit different for girls, because it is really important that that's being flagged up. And we know that teachers in their teacher training do not have very much time given to this at all. So it is really important that then happens once they qualify and once they begin to work, that they can access that kind of training, and but also advice from whether it's their educational psychologist or other professionals in the network working with schools, so that they can talk these things through. And I think having an awareness that for girls, some of them will be masking, so those symptoms won't be obvious, and particularly if you invite them into a one-to-one meeting, you wouldn't particularly notice some of these difficulties. But actually, as you say, if you observe them in a class of 30, and you know what you're looking for, then actually sometimes you can pick up those difficulties. And I think one of the things I've learned over the years is that the most important thing is to listen to the girl, to hear her voice, and to ask her for her experiences. And I think as parents, we're pretty good at doing that. And in schools, we might ask some of those questions, but children are good at just kind of giving a quick answer, and if they want to go out to play and just get on with the rest of their day, and kind of fobbing you off a bit. And so I think it's trying to develop a relationship with a girl who you might have this kind of wondering about, and then over time beginning to explore what her world's like. How does it work in the classroom for her? What are the challenges for her? But also, what are her strengths? What's the stuff she loves to do and finds easy? Because that's actually just as important information. But having that conversation through a relationship, rather than just being called into someone's office for a 5-minute chat, where you're not going to get that quality information. And I think we've as a service where I work, but in my private practice as well, we really value hearing from girls directly. What is your experience? How has things been for you at home, at school, but also in hobbies and clubs? Often there's lots of stories of dramas at swimming lessons and trampolining club, and all those times when you have to wait that are really tricky. All of that's really important information. It's not just about school.
Yeah, that's completely right. And like for a girl that perhaps have rejection sensitivity dysphoria, also contributes to anxiety. So like it's the way how the teacher speaks to them can also severely affect them. I recently saw a video by ADHD Richmond, where one of the girls said that you think of bullies and you think that it could be your peers, but actually your teacher could be a bully, and they might have been doing it unknowingly. They might be stretched because like in a state school you have 30 children in one class, and if one child doesn't behave or act out, then they can be sort of like commented upon, remarked upon in a way that could be embarrassing to them, and they can perceive that and so much more serious than the situation actually was to the teacher. So
I know that video very well, and it absolutely, that is the most powerful line of the whole film. In fact, we've quoted it in the book because we talk about it, and we have a photo of those girls in the book because that film actually it really does tell it how it is for girls. So it's a great resource, and we sharing that with schools is a really good start on helping them understand what ADHD in girls is. If everyone could watch that film, that would be a brilliant step in the right direction.
Oh, that's interesting, Joe. It's amazing that you picked up on the same line, because I thought, wow, yeah, that's right. That's exactly right. Because you don't think of that, because maybe that's one of the reasons why people are refusing school, because they're worried about being embarrassed, by their teachers or people who have authority above them in the school, where they are not, they feel they can't really voice their opinion or say anything because that would be a disrespect.
Yeah.
So yeah, in my daughter's case, we have spoken to the school saying how much, she has anxiety and RSD. And they have taken it on board. They're going to try to be so gentle with her. Now to the point that they are actually not telling her when she's doing something wrong. So how do you navigate that? How do you speak to a child with ADHD, about what's right and wrong? And, just kind of like educate them about that, that won't impact their self-esteem, and at the same time, teach them right from wrong.
Yeah, it's so important to be clear with them, because they do need to understand, absolutely. And I think having those conversations, but maybe having them in a group or a small group, is also a really nice way of doing that, so it doesn't feel like it's personal. It's about one child having to learn this, because actually all children have to learn what's right and what's wrong. But obviously we need to kind of tailor that conversation to individuals, but actually doing it in a group is actually much more supportive, and will provide much more learning, because people will come with different perspectives about what's right and wrong. And I think for children it's all about making it fun and engaging, and it's all about also including it being visual, and whether there's pictures of things that are right, and what we're looking for, is the behavior we're looking for. And sometimes we've done things where even it's taking photographs, so you ask the child to act out what does good look like, and then I'll take a photo, and this will be a reminder of what we're looking for. When we say sit nicely at your desk, what does that mean? Okay, so right, well, let's practice sitting nicely at our desk, let's take a photo, and then we can have that as a reminder of what sitting nicely at your desk is. So I think it's just trying to be a bit creative and a bit fun, and focusing on the positive and what you want to see. We always do spend quite a lot of time talking about what we don't want to see, and the negatives, but actually if we talk much more about what we want, and what we're encouraging, that's a kind of much better way of doing things psychologically, giving them the idea in their mind of what you want from them rather than giving them the idea of what you don't want.
That's right, because they are so used to being told what we don't want from them, that they just internalize all this negative messaging, and it becomes a part of them, and it really affects their self-esteem. Like, I do find it a landmine, to navigate, and definitely a job for a professional.
Yeah, and I guess that's it. There's there's never a right or a wrong, and it's about a journey, I think, for these children, and particularly a journey of like exploring strategies and what works for each child, and things change over time. So something might work for a while and then not work, and sometimes you might want to revisit that. And I think it is good to try and be collaborative, and that the child is part of coming up with the strategies, reviewing them, and that conversation, because it will be much more meaningful to them, and they'll be much more invested in giving it a go, rather than being told, right, this is your I don't know, card for the day and what you have to do. It's like, actually, let's create together what we're going to do. You're part of this, and actually once they're collaborating in it and feel invested in it and listened to, then that will hopefully help them engage much more with that as well. But all of that takes time and energy, and that is tricky, and I appreciate in schools, particularly when you've got 30 children, this is a big ask.
No, yeah, absolutely. Like, it's so great that we can give all these recommendations, but the school has such a pressure to meet all these learning objectives, and, like, making sure each child is meeting their learning goals, that when I, suggest these strategies, I almost feel like we're asking for too much, in a mainstream school, but if a child is labeled as SEN, then they have to give it, but in this regard, because my daughter hasn't, then it's an extra thing for them, which they're doing now out of the kindness of their heart. So it is a journey for sure. And
but I also think that lots of things that work for children with ADHD are part of what work for all children, and what we call quality first teaching. So this is what we would expect to see in any good classroom, some of what we're talking about. So actually, there's no reason why it can't be implemented for a whole class. So things like movement breaks. Actually, every child will benefit from a movement break, and most adults as well. So actually, if a school can do that, and it's also better than singling out some children, who don't like to be the focus of attention and be different. So actually, we can do something for everyone. It's not going to do anyone any harm, and actually it might do everyone some good.
That's a great idea, actually. I mean, because it doesn't have to be a long break, does it? I mean, it can be.
No, yeah, just 1 minute of and there's loads of great examples on the internet where you can put on a fun piece of music, or and have a movement break with set dance moves, or all sorts of different ways to do it. So
I see that one of the things you do is that you provide camps in the area alongside mental health support teams in schools. Do you then work with the schools to come up with strategies that can help individual children, or to revamp their SEN provision?
So certainly some schools we would do that with. If we were working individually with a child and that was an issue, then we would provide some support and advice around that, absolutely. But also, I think the mental health support teams in schools, this is a new government initiative, and that also means that there's more early intervention in schools for emotional well-being more generally. So aside from SEN, I guess, but often it benefits those children as well. But there are also lots of other people that are in contact with schools that also do this kind of work, whether that's an educational psychologist, or other professionals that sometimes come in and have contacts, behaviour support advice and things like that. So there can be other ways for schools to kind of get the advice, and often schools develop their own expertise in these areas, because particularly if it's a large primary school, they will have plenty of students that have similar difficulties. So over time, certainly some of our Senkos and teachers will become their own experts in this area. And I think what's really important is that each student is and particularly with ADHD, each child is treated as an individual, because as we've already heard, ADHD in girls can be quite different to in boys. But even within girls, as you say, you can have some girls who are hyperactive and impulsive and some that aren't. And so it's just so important that we don't treat everyone with a broad brushstroke, and we think about their individual needs and work with them as an individual to work out what strategies would be helpful for them.
Yeah, that's really insightful. And you mentioned the mental health support teams, and that's a new initiative you mentioned. Is that like available in every schools, or?
So it's not in every school. So the government wrote a green paper, and then some resource and funding has followed through. And then throughout the UK, different areas have bid for that funding over time. And it's kind of a phased approach. So each year, new teams are launched and new funding is released. So I think in the end, the ambition is that it will be in I think it's 45% of schools across the UK, but that's nationally. In some areas, there may be much bigger coverage than that, and there might also be some areas where additional resources put in to make it 100% coverage. It really varies across the country.
So is that like a provision that the school has to apply for, rather than,
So the local area applies to be like a part of the scheme, and then they will develop their own mental health support team, and it fits a kind of formula that's written out by the government in terms of who might be in that team, what that kind of looks like. And the work of that team is based around something called the whole school approach, which basically means that emotional well-being is thought about in terms of for pupils and students, in terms of staff, and also in terms of parents and the curriculum as well. So it's really very encompassing, and I think COVID has really shown us that the emotional well-being of teachers and adults in school is as important as that of pupils, and because actually we all know that you have to look after yourself as an adult, whether you're a parent or a teacher or a psychologist, in order to do the work that you do and to support the children that you look after.
No, that's right, because we are also human, right? And in
Absolutely.
Yeah.
Yeah.
This is so interesting. I'm just wondering, say right now, if there's a child navigating school and they are intelligent enough to meet the learning goals at their level, but they have developed, self-esteem issues and anxiety. What sort of support can they receive, if they can't go on SEN yet, and they're obviously having issues with school? Like, how can, and their parents ask for help?
So I think it would depend on the level of anxiety and difficulties, but we would always say it's really important to start with a kind of a self-help approach. So resources for parents, and sometimes there are some really lovely resources written for young people and for children, to help them understand their anxiety and worries, and parents can do those pieces of work with their own children. Also, we know for primary age children, it's really important that parents have good advice about how to manage anxiety in their children. They spend the most time with them, so it's super important that they're skilled up and knowledgeable to do that. So Kathy Cresswell has done lots of work in this area over the years, and her work, she has a book called Overcoming Your Child's Fears and Worries, and in that book it's a resource for parents really to talk them through what anxiety is and how to support your child with anxiety, and how it's really common that sometimes we end up accidentally reinforcing anxiety through our own behaviors, or we might have our own anxieties as parents, and kind of tackling that in order to tackle your child's difficulties. So I think that's ultimately the kind of first stage. And then I think it's always good practice to speak to your child's school if you've got these kind of worries. And some schools may well have some small group work around self-esteem or around anxiety that children can access. And sometimes they're facilitated by a teaching assistant, but they might be using a certain workbook or structure to those groups. And some schools have something called an ELSA. So that's an emotional literacy support assistant who can sometimes work with a child one-to-one to give them some, really nice tips around worry and a space to talk. But also schools have a range of different things. So some schools have kind of drawing workshops sometimes, or Lego therapy, all sorts of different things that can be I guess a way to give a child a space to explore some of this. Yeah. But I think if the difficulties are really significant and they're having an impact on a child's life, perhaps in quite a significant way, then I guess it's talking with the school or thinking about whether a referral to an outside agency would be helpful for that child. And so in lots of areas, they have now something called a single point of access, a SPA, and that all the referrals kind of go through that hub and are then filtered out to the kind of best team or group of professionals to help with those kind of difficulties.
All right. See, yeah, we were referred to the SPA, the SPA, but they have decided that the referral will be cancelled because the problem wasn't serious enough. So like they did say that, they did give a few recommendations and then say, come back to us in 10 weeks, if there's some more issues. So
okay,
let's hope that.
Yeah. So that's the kind of probably the self-help type stuff.
Yeah, exactly.
And that stepped approach is really important, that we don't rush in with lots of therapy right at the beginning. For some children, it's kind of gradually try one thing, then try something else.
Yeah, exactly. So with children who have ADHD, they need to feel safe and secure in order to learn. And I suppose that's uniform, across all children. But because children with ADHD are more driven by their emotions, so what do you think a good environment would be for them to navigate learning, in their school with safe and secure environment that will make them feel calm down if they have anxiety?
Yeah, I mean, I think it's as you say, it's feeling safe and secure. That's absolutely got to be the goal, hasn't it? Because we know that then means they'll be more open to their learning. And I think, as I said before, kind of doing it on an individual basis is really important. So having that individual approach, and some children with ADHD will really benefit from some support around emotional regulation, and how to manage if they're feeling a bit overwhelmed. And there'll be different ideas for different children. That can be really important, and the environment in school can support with that. I think one thing we know is it's really important not to tell children off or give them consequences for what is their ADHD. So actually, if somebody keeps interrupting, which may well be part of their ADHD, it's really important to try not to tell them off for that, but to try and constructively support them to do something differently kind of going forward. And one thing we always say to schools is really try not to take away playtime or lunchtime, because those movement breaks are so important for all children, but even more so for children with ADHD, to have that opportunity. So even if they haven't finished their piece of work because they've been distracted, not focusing, calling out other ADHD behavior, please don't ask them to stay back and complete it. We need to find a different way to kind of manage that, because actually cutting playtime is not helpful. You'll actually cause yourself more problems for later on in the day as a teacher. So it's really important to kind of hold that in mind. And I think working with a child's strengths, I guess, as well, is, children with ADHD have loads of strengths, and trying to harness those and bring them out and celebrate them will also help with their self-esteem, but also with their learning potentially. And I think once, if girls do have a diagnosis, trying to use role models and examples of women who have ADHD and explore them. So the gymnast Simone Biles is a great example of an adult woman with ADHD who obviously is successful and has channeled her ADHD into her sport. And so trying to be positive about these things is really important, but at the same time without dismissing the difficulties that clearly come with the condition.
Yeah, and that's why actually knowing what condition they have, it's a good start, so that then they can get more understanding in school and the people around them, and then help to recognize their strengths and nurture them from a young age. And I think that's really insightful. Thank you so much for this amazing interview. I'm before we end, is there anything you want to add, or if you can tell us maybe about your plans with the book, or any sort of work that you want to do from here on?
Yeah, I mean, I think the plans with the book, obviously it's quite new out, and publishing a book in the middle of a pandemic is always a challenge. We have done some book launches, but there'll probably be lots more that kind of drips out over the next year. So we will continue to be talking about it and really trying to get the message out about ADHD in girls and women. That's really important, I think. And yeah, just continuing that work and thinking about what else is needed out there for girls, and particularly in the UK, where do we need to kind of turn our attention to. And I think research is definitely an area that is much needed, and because so much of the research on ADHD is done with boys, because they use clinic samples and they're mainly full of boys. So it kind of perpetuates itself in a way, so the issue. So hopefully we can kind of move on a little bit with some of that. It does feel like we are definitely making steps in the right direction. There's lots more conversation happening about this over the last year or so. So I feel optimistic.
Yeah, I feel the same, like I've been talking to a few people on LinkedIn, and we've been saying that this is the neurodiversity revolution. It's time that neurodiversity is accepted and normalized, without the stigma, because we know that there are a lot of people who have achieved, great things, who have lived great lives living with ADHD, despite some difficulties, but also because of their ADHD that they have managed to thrive. So it's important that employers and organizations also recognize that ADHD can be a strength, if it's channeled the right way, and if we can motivate the employees to give their best. So thank you, Jo. Thanks for being interviewed for ADHD Girls, and I look forward to reading your book.
Yeah, it was really great to meet you.